Welcome to the Rules and Open Government Committee and Committee of the Whole for March 18th. We'll begin. First, I'll just note that we have a quorum of council members, Camus Davis and Vice Mayor Jones present. We'll begin with a...
Arenas is on the phone. We're just trying to get the audio to her.
Okay, great, wonderful. Just ask Councilmember Rance, are you able to hear me right now?
Hello, hi, this is Sylvia.
Great, good to have you. And we now have Councilmember Rance as well. Perfect. Thank you for everybody for managing that. We'll start with a review of the final agenda for March 24th. And I'll note for the maker of the... Oh, no, you're fine. We're just reviewing the agenda on March 24th.
Hi, this is Sylvia.
We can hear you, but I don't think she can hear us.
Sylvia, can you hear us?
I can barely hear you guys.
Okay. All right, well, we're all going to try to talk very close to the mics.
Oh, wonderful, thank you, I appreciate that. I apologize I'm not there, I just need to be at a doctor's appointment.
Of course, of course. So,
Anyways, thank you.
Sure. So we'll begin with the March 24th agenda. I know for the maker of the motion, there are some adds on the consent calendar, as well as a couple of items relating to the COVID emergency. And then we'll review the agenda, the printed agenda starting on pages 4 and 5. Are there any changes there? Any changes on pages 6 and 7?
I just wanted to note that items 2.10 and 2.11 will have replacement memos coming out to allow for those special event dates to change if needed due to the COVID-19 event.
Great, thank you. Pages 8 and 9, any changes there? Pages 10 and 11. Pages 12 and 13. Pages 14 and 15. And page 16. Okay, on the agenda, I don't have any cards, do I, Henry? I don't have any cards on A1, do I? Okay, great. Is there a motion?
Motion to approve the agenda for Tuesday, March 24th with a sunshine waiver for an ad sheet for several items.
Second.
All in favor?
Aye.
Aye.
None opposed. That passes unanimously. On to, are we required to do a roll call, Tony?
Oh, shoot. Yes, sorry.
Okay.
I forgot.
That's all right, I forgot too.
Councilmember Camus?
Aye.
Councilmember Davis?
Aye.
Councilmember Arenas?
Aye.
Vice Mayor Jones?
Aye.
Mayor Liccardo?
Aye. Okay, the agenda for March 31st is canceled. There's no meeting on that date. So we'll move on to the meeting schedules. Diridon Station Area Plan has a study session proposed for April 24th. Is there a motion?
Move approval.
Second.
Any comments? Okay, Tony?
I thought we're dropping this
I
item.
think we are.
Oh, we are?
I think we're dropping this.
Yes.
Okay, we're dropping.
Thanks,
this.
Tony.
We got lots of other things to work on, I'm hearing. Thank you. Okay, so we're gonna, I think for the members of the community or public, just so you know, we essentially, yesterday we canceled all of our committee meetings except for this one. City staff is wholly focused on responding to this crisis right now, or with the exception of obviously the essential functions that we continue to provide in the city. And so many meetings, which you may expect, will be moved and deferred until we're all able to better focus. Okay, on to public record.
Motion to note and file.
Second.
All right, on that motion, Tony?
Councilmember Camus,
Aye.
Davis,
Aye.
Arenas,
Aye.
Vice Mayor Jones,
Aye.
Mayor Licardo.
Aye, okay. That's unanimous. We'll move on to the consent calendar.
There's nothing.
There's nothing there, okay, even easier. Okay, item 2 is the approval of District 10 grant for Kiwanis Club.
Yeah, yes, I have to do this. This is for the turnaround scholarship for kids. The Kiwanis actually helps kids pay for college. And since my wife is a member of the Kiwanis Club, which doesn't actually receive any of this money, it goes to the turnaround scholarship, which is a separate 501c3. But I felt it prudent to ask for permission.
Move approval.
Second.
Okay, on that, Tony?
Camus,
Aye.
Davis,
Aye.
Arenas. Vice
Coun-
Mayor,
Councilmember Arenas?
Aye.
Vice Mayor Jones,
Aye.
Mayor Licardo.
Aye, okay. On to item 3, which is paid sick leave ordinance. I know that Councilmember Esparza is here, and everyone has the memorandum, I hope. Councilmember Esparza, do you want to lead it off?
Sure, thank you, Mayor. I wanted to add a few comments because this, like everything else related to COVID, is fast-moving. And so I wanted to bring it to everyone's attention that when we brought this proposal forward last week, we modeled the proposal that we brought forward specifically on Senator Murray's bill. And the companion House legislation has moved forward since that time, but the White House negotiated, or through the negotiations with the White House, it was essentially gutted. A lot of the assistance for things like sick leave were gutted in those negotiations, and leaving many employees throughout the nation without coverage. Today, there was a bill that was passed in the Senate, 90-8. However, none of the amendments were passed. So we don't have the sick leave resources that we thought we might have in time. So basically, also what I understand from Congresswoman Zolofgren's office is they're all still in negotiations and it could take some time. So given that situation, I wanted to continue to move this forward because in the items that were gutted in the negotiations with the White House is large companies with more than 500 employees are not mentioned in the federal bill. According to the Department of Labor, 89% at large companies who have some paid sick leave only have an average of 8 days, which is well short of the 14-day quarantine. There's also another loophole of fewer than 50 employees, and there are loopholes for healthcare providers like hospitals and nursing homes. And then although sick leave is to be paid at the usual rate, the family leave is paid at 2/3 of the rate. And so, you know, other major cities in the state have paid sick leave, and given the fact that this is literally a matter of life or death, we're moving forward with this. And I understand, as we all had talked about extensively last night, that it's a time of unprecedented strain on our economy, and that we as a city are committed to, thanks to Vice Mayor Jones's memo, we're committed to supporting our small businesses and keeping them afloat. But really, all the extreme measures that we're doing as a city and as a county, as a state, are to curb the spread of this virus. And I wanted to comment that if we do fail, it will hurt and strain the economy even more. There was a Times article that referenced that if we don't do our part, this could extend as long as 18 months, which none of us wants to happen, and there could be multiple waves. So we need to do what we can as a city to ensure that we keep our community safe. And I wanted to add one more comment about pragmatism, is that it's pragmatic to allow people to be home when they're sick and to take care of loved ones who are sick. That is the ultimate in pragmatism during these difficult times.
Thank you. Thank you, Councilmember. I know Councilmember Arenas also is a co-author of this. Councilmember, do you want to be heard?
Yes, thank you so much, Mayor. I obviously am supportive of Councilmember Espasa's comments. I'd also like to just add that what we did yesterday, although it's very noble and prudent on our part as council members and you as a mayor leading the charge in terms of supporting renters and supporting small businesses, now we really need to support the average worker, especially those in service industries or those classified as essential workers, because none of what we've done so far has provided or given any money, placed any money in the hands of the average worker. And although I know that it's important to have food on the table and there's a great deal of effort to make sure that that continues to happen under your leadership, Mayor, and a lot of private and public partnerships, we really need to make sure that there's cash on hand as well for these average workers. And this covers what the the federal government isn't doing. And I think we are at a point, we are where we are with this shelter in place because the federal government didn't react and respond appropriately right from the beginning. So I think that learning from that lesson that we need to respond appropriately right from the beginning for our San Jose residents.
Okay, thank you. I know there's several members of the community who wanted to speak, so let's hear from the community, and then we'll come back to city staff and the committee. Starting with Vaughn Villaverde. Forgive me, Vaughn, if I just mispronounced your name. Jeffrey Buchanan, Jeff Christina, and Jesse, I believe it's Trang. I can't quite read the writing, but Jesse. Oh, thank you.
Good afternoon, Mayor Liccardo and members of the City Council. My name is Vaughn Villaverde, and I'm actually here to read a statement from Michelle Liu, who is the CEO of the Health Trust, who unfortunately can't be here, and who is also urging the Rules Committee to pass a paid sick leave ordinance. Workers having access to basic paid sick leave protections is not only good for the health and safety of workers, they're an important part of maintaining our infrastructure during emergencies like the one we're in. As you may know, the Health Trust runs a Meals on Wheels program that last year served over 169,000 meals to food insecure individuals in our community. And we're currently ramping up our efforts to meet the demand brought on by the COVID public health emergency. In doing this work, we've come to understand that our food systems are a critical part of any community's infrastructure. Many of the hourly and contracted workers who work do not have access to adequate paid sick time in jobs within our food infrastructure. These workers staff our grocery stores, prepare our meals in restaurants, and deliver these meals to our door. Without paid sick leave protections, workers who can't afford to miss a paycheck when they're sick become potential vectors for disease transmission. Federal legislation on paid sick leave currently being negotiated between the House and the Trump administration will likely not cover the workers who need it most. And as our community adjusts to the new reality brought on by this global pandemic, we need to ensure that our food infrastructure not only remains functional and robust, but that it doesn't become a way through which this disease spreads. Michelle urges the committee to pass these vital protections. It's good for workers and better for public health. And I also have, aside from that, a petition signed by over 300 San Jose residents that we'd like to submit to the Rules Committee for your consideration.
Thank you. If you could leave that with our city clerk. Thank you.
Jeffrey Buchanan on behalf of Working Partnerships USA and Silicon Valley Rising. There's a lot of folks that endorsed this measure who aren't able to be here today, so I'm just going to name check them. Minority Business Consortium, Gardner Health Clinic, Somos Mayfair, the YWCA, the Silicon Valley Wage Theft Coalition, Teamsters Joint Council 7, Unite Here Local 19, Law Foundation, PACT, Fight for 15, Carpenters Local 405, Representative Rokana, Assembly members Ash Kalra and Kansan Chu, Senator Jim Bell. It's time for San Jose to join the 3 other largest cities in California and having its own paid sick leave ordinance. Back in 2014, the last time we looked at data, over 100,000 workers had no paid sick day. Since then, it's likely that they only have 3 days provided by the state policy. That includes over 50% of Latino workers in the city, so there's a huge racial justice issue here. As a city, our #1 issue is flattening the curve. Really, when we think about these essential workers, the Uber Eats driver, the McDonald's franchise worker, the grocery clerk, the home care worker, many of these workers don't have paid sick days. And so if they're going into work sick, they have the potential to spread the virus to 2 or 3 additional folks. Really, we need to ensure that it's easy to access sick days. We've seen in other emergencies, the H1N1 virus, for instance, 30% of workers went into work sick with the virus, resulting in 7 million people more being infected. Now's the time to act. Additionally, we need to look to fill the gap. You heard already from Councilmember Esparza, there's over 80% of private sector workers who weren't going to be covered by what just passed the Senate. Really, we need to fill this gap. The good news is that in that bill, for businesses under 500 workers, there's a fully refundable federal tax credit for your expenditures in relationship to paid sick leave. And so our biggest employers, certainly they have more economic wherewithal to be able to carry this mandate. For our smaller employers, they are going to be able to leverage federal refundable tax credits to pay for these things. We're in a hot spot in San Jose. Let's take action. We don't want to look back and say there were tools that we could have used that we didn't deploy. Let's move this forward. Thank you so much.
Mr. Buchanan, I'll ask you to come back to the mic in a moment. I have a question or two about the federal legislation, specifically what businesses would be covered. I know it's a moving target. I just want to understand better. Mr. Christina.
Mayor, Council, Jeff Christina from Green Waste Recovery, Anchor Recycling, and Business San Jose Chamber PAC. What's been really interesting is just listening to that list of endorsements. That list of endorsements doesn't represent one business. That's a lot of different nonprofits or unions. Right now, businesses are firing people. The cost to what you're doing just to Green Waste Recovery alone will be so impactful, every single person in the city's rates will increase slightly. Every single person from one company because of this policy. There's a significant difference between paid time off and sick leave. And for Green Waste alone and for Zanker, we give a significant portion higher for the paid time off than we do for sick leave, but this is very costly. And over the last couple of days, while I've been trying to talk to businesses to come today and to write you letters, I have found out that tens of different people just from my immediate circle have fired people or let go of people because they cannot afford to keep them employed. What this is going to do is increase those costs. More people are going to be losing their jobs. I'm pretty sure that unions aren't going to like that, but when it comes down to a point where businesses don't have any money, and when you have no income for a few weeks, few months, you have no money, you can't pay people. And what this is doing is just putting a significant hardship on a lot of small businesses. It's going to particularly sting a lot of mom and pops, and it's going to be disastrous for our community during a disaster. The impacts of this will be horrendous, and we cannot allow something like this to go on. If this is ever something that's considered, it needs to be considered in a time where everything's going good and the costs can actually be absorbed. Right now, we can't absorb more costs. We can't take it. The businesses absolutely can't. I'm here representing a few hundred employees. I want to save these people. These people are my family. I've been raised with them. This is a family business. I know many of them by name. A few of the newcomers I don't, but out of hundreds of people, I've known them since I was a little kid. They are important to me. I want to protect them. This does not protect them.
Mayor, can we have the microphone wiped down perhaps out between speakers?
Oh, yeah, that has been a standard practice in the other room when we had
I don't have the
speakers in other
wipes.
rooms.
There are,
We have some
Tony,
wipes?
there are wipes in the green room under the sink.
Okay.
Just-
Yeah, it's a good suggestion. Thank you, Councilmember Camus. We'll just take a moment while the wipes are being retrieved. And we have 3 speakers left. Jesse, followed by Teresa Nunes, followed by Huascar Castro.
Chappie's got his beer up.
Good afternoon, Mayor. Good afternoon, council members. I'm here on behalf of Community Health Partnership. My name is Jesse Tarango, and I work in workforce development for them. We represent 10 community health center organizations that serve a population of about 165,000 low-income individuals. Most of our population are under 200% of the federal poverty level, and for those not familiar, that would be about $43,000 for a family of 3. So a lot of these patients are the frontline workers that are serving our food, delivering our food, our contract and hourly workers that can't afford to make ends meet without their job, without their hours. I also work with interns, students that they have to do whatever it takes to keep working, to keep studying, to keep getting any money they can. So oftentimes people will continue to work even though they're sick. They will not take their time off if it's unpaid. They need to continue paying rent, continue paying for all the services that they need as well. I strongly urge you to consider passing the paid sick leave ordinance. Thank you.
Thank you.
Hello. Hello, my name is Teresa Nunes, and I work for Santa Clara County Probation Department, and I am a member of SEIU 521. I'm here to speak in support of the paid sick leave ordinance. We are all in a very difficult time and uncharted territory. It saddens me to even see this as a topic or debate. Many of these people already struggle on a day-to-day basis, living check to check. Losing pay for them will be devastating to their families. As a single mother myself, I know the pain, stress, and worry of not knowing if you have enough money to put food on the table or pay the bills. The decision to continue to work while they are sick or a family member is sick is not an option. They must work to feed their families, which in turn will increase the spread of the virus and continue to cripple our community. Also, as a worker of juvenile probation, we often see many kids who feel like they have no hope because their families cannot provide for them. So they look elsewhere for the support and the things that they need. Most times it's from negative peers, and they begin to commit crimes that then affect our community. Let's stop that right here, right now. I ask you to please take deep consideration on this matter and support this critical ordinance. These are our brothers and sisters. These are your brothers and sisters. At a time like this, we need to take care of one another. Thank you.
Thank you. And finally, Waskar.
Good afternoon, Mayor and members of council. My name is Waskar Castro. Good afternoon, Mayor and members of the committee. I'm here on behalf of Silicon Valley at Home to voice support for the paid sick leave ordinance as introduced by Council Members Esparza, Carrasco, and Arenas. As a housing policy and advocacy organization, SV at Home focuses on solutions that address our housing crisis, which was already a daunting crisis before the realities of COVID-19. We know that even in the best of times, working class people in San Jose struggle to afford housing and keep up with rising rents. Many workers don't have adequate paid sick leave benefits that allow them to take time for self-care and not worry about lost wages and how the rent will be paid. By adopting a sick leave ordinance, the city will ensure that people can take the needed time off and still afford essential expenses such as food and rent. This is of critical importance in times that we face now. We don't want people who are sick working. We would like to express our gratitude to the City Council for taking swift action on a multitude of issues during this challenging time, including the adoption of an ordinance that puts a moratorium on evictions. We urge the Rules Committee today to support this initiative and act expeditiously in moving forward so that there are protections in place for working families throughout the City of San Jose. Thank you very much.
Thank you. Okay. Thank you to the members of the community who came out to speak. Dave?
Yeah, so thank you. So we haven't had much time to really work this through. I do want to acknowledge the importance of it and really probably ask for some time here, but I think want to kind of get clear on what we're trying to accomplish with this. If we're trying to accomplish the economic impacts, I think that's one thing, and that's a much broader thing. If we're focused on the public health crisis, totally understand the perspective of, and remember in our region now, we are now in a unusual environment of having essential workers and non-essential workers. Non-essential workers are currently already home. So now we're focused on essential workers, and we certainly want to create an environment where essential workers are not compelled to come to work sick and spread the virus. That's the public health crisis. And so we need to, I think, if we're here to address the public health crisis, kind of narrow our focus on that aspect. I also want to distinguish between, our city public sector workers, what we have a plan for, and whether they are essential or non-essential, they are all getting paid. And so, that's, I think, an important distinction also to make. So that's kind of where our thinking is. I know there's a lot of other moving dynamics here in terms of, the legislative process. And so I would ask for a little space, even if it was just to come back next week with an update or something. I know on the memo it said come to council on the 7th, so a little space would be helpful to us.
Right, I understand. I don't even think you have anybody from OED here, so, because right now they're all in Emergency Operations Center.
Yeah, and just so so that we're not being dismissive of anything, I had the opportunity to sit down with Kim and Jennifer and Ed briefly just before this meeting, just to kind of, do a quick look at it. I think as an organization, we are right now solely focused on addressing the public health crisis, but recognizing the economic impacts this is having, and don't want to be dismissive of that. That is taking a little bit of a backseat for us right now to the health crisis that we're trying to address.
Right. So, given everybody is running very hard, and particularly since we now have had, I guess, some additional responsibilities on our shoulders about food distribution, I want to be able to have the space to be able to put something out that's going to be effective. I think we see that the federal legislation's moving, but it is a bit of a moving target. And I wanted to ask Jeffrey Buchanan, you mentioned there may be federal reimbursement for some employers. Do you know anything about the latest, which employers exactly get reimbursed? Is there an employee cap or?
Yeah, so anyone who's been 500 cap, right?
Talk to.
Sorry, the provisions only cover the 500, so less than 500. If you have less than 500 workers, then you can be able to apply for a fully refundable tax credit for each calendar quarter. And that will cover both of the paid sick and the paid family leave portions of what the Senate voted on. It's my understanding, I've been in communication with a couple of organizations, lobbyists who were a part of the effort in Washington to get updates. It's my understanding there were not substantial amendments through the Senate process. There was some House cleanup language to make it different than if you looked over the weekend at what it was. Come Tuesday, or come Monday, there were some changes there, including the inclusion of making the tax credits fully refundable.
Okay. So.
And then just the clarification on the
Does
lesson.
that mean a one-to-one tax credit? Is that what you're referring to? Is that,
so
for every dollar expended, there would be a full dollar value?
there is a total cap on the total amount across the program of the tax credits. Again, I think we're seeing that in Washington there is certainly lots of interest in spending at the moment with the proposal of another more than $1 trillion package to come after this. And so, I think the creation of the process around the tax credit, it's hard to say. I mean, it's a substantial number. I don't have the numbers here in front of me, but glad to share those after.
Okay.
Yeah.
Thank you.
Thank you.
So I appreciate there's, staff needs. I had some questions that I'm hoping could be answered through the next week, between now and when you come back. Understand the importance of getting something done in a timely way. But I think we also understand this is not simple and is going to take some work. One is, obviously, we want to understand very clearly who is covered and who's not covered by the federal legislation. I understand it's a moving target, and I think we'll want to have some clarity on that to understand where the city can best assert itself. Second, I know there are various rules in place now between various cities. I think San Diego has a minimum of 30 hours. SF in Oakland, it's 40 hours or 72 hours, depending on the size of the employer. California, of course, is 24. So just understanding where we fit relative to the reasonable expectations of employers in the region. Third, just understanding the staff work, both to create something like this as well as to implement. I sense there's a desire to do so quickly with the urgency of the moment. It would be helpful to understand how feasible that is given whatever else we're doing with essential employees, or who we can bring on who's in the non-essential category who could be used to help us implement this. We understand everything from food distribution to childcare for first responders, or those are the things that are on our plate, and we're trying to move fast here for that. And then to whatever extent we're able to get any feedback about what categories of businesses might be more likely to respond in a way that is counterproductive. And I know that requires some amount of outreach. I mean, I've already had 2 conversations with employers in the last 4 hours who are issuing pink slips. So obviously, we don't want to expedite the issuance of pink slips. We're trying to figure out how we do this without actually killing the goose. So those are some of the questions I had, and I'm hoping that can be considered as we're coming back here. And Ed, I'm assuming that the city can do this legally. I know that other cities have, and it looks like in San Francisco they went to the voters. That's not a requirement to go to the voters, is it?
No, there are about 7 other cities who have implemented it. And San Francisco was an initiative, but there are several cities who've done it on their own. They've adopted it, and they've adopted it under the authority to provide minimum labor standards. So many of those ordinances are simply an amendment to the minimum wage ordinances.
Okay. So it would be helpful, I guess, to understand then from staff, going back to Dave's original point, I think we all recognize the economic impacts of this virus are far broader than even the severe health impacts. Is this essentially going to be an urgency ordinance for the duration of this emergency, or are we creating something that is permanent? And if we are creating something permanent, does that work? Is that work something we put off through prioritization and work on what we can get done in a short period of time for this urgent period? That's another question that would be helpful to have fleshed out. So I'll stop asking questions now. Other comments? Councilmember Davis.
Thank you. Yeah, I had the same question about whether this would apply only to essential workers. And if it doesn't, if this is something that we're going to make permanent, the thought that came up for me, knowing that we already had a struggling arts and culture sector because of AB 5 and trying to figure that out, how AB 5 would fit into this. That was one question that I had. Again, that's assuming that this was going to be a permanent thing. And then the other question I had, when I worked in the private sector, we didn't always have sick time and vacation time. Sometimes it was rolled into one PTO time, and you used it regardless. And so I don't, for those employers, I wouldn't want to add on to additional time because they've already got their accrual at a specific rate to account for both of those things. So how do we account for that if they've already got sort of a bucket PTO time? So that would be another question that I had. And then the other thing, because the federal government is already working on this specifically, and they're also working on an economic stimulus package, an aid package, I wonder about duplicating the efforts where we need to be on the ground right now versus waiting a couple of weeks, seeing how that all shakes out, and then having staff turn to this if that doesn't pan out, which I actually think it will, because everyone is panicking in every state, in every little town, as far as I can tell. So I tend to think providing for our people right now is the most important thing that our staff should be doing, as opposed to duplicating efforts that are already happening at the federal level.
Okay, Councilmember Camus?
Yeah, I also concur with the sentiments that Councilmember Esparza, Arenas, and Carrasco put forward here, and I do have major concerns with even going down this path as a city. The memo is not clear. I mean, it looks like it affects every size business. It doesn't matter whether it's a mom and pop hair salon or a dry cleaner or anything, you know, that they don't have the infrastructure to even, or even the knowledge to apply for a federal grant when their employee is out sick. And so I have deep concerns about how this was going to affect our small business community. Yesterday, we made a huge effort to show that we are concerned about the needs of our small businesses. In fact, I don't know how they're going to survive through this current downturn financially, and I think that this could strain them even further by giving them more regulations and more hoops to jump through. I'm also concerned that we only had one business be aware of this. I mean, obviously, we are only hearing from one side of this equation, and since this will affect business, I'm hoping that we can actually get some business perspective and see how they would be affected. I'm also, I think the attorney, this would have to go through the attorney's office. As Ed said, I mean, kind of jokingly, but it wasn't a joke, the attorney's office is a non-essential service. And so that we'd have to call them back to work on this issue. And so, and I don't know that something could be put into place and implemented in time to deal with this pandemic. So, and I also concur with Councilmember Davis. Somebody else is already working on this. Why should we try to reinvent the wheel? What I'd rather see is our staff monitor and come back to us with information that's coming in from Congress, or I heard that even the governor's office is working on this as a statewide issue. I also don't want to see our city isolated in its policies, and where you can go outside to Santa Clara, Los Gatos, or Campbell, or Cupertino, or any of the other cities and set up office and not deal with, you know, the Measure E and all these other regulations that they already have to jump through. And so this will be one more. So my suggestion would be to ask staff, or I could make a motion to ask staff to follow the federal regulations and how it's going forward, and come back to us in 2 weeks' time to see if we need to do anything rather than what should we do. And I'll make that as a motion.
Can I interrupt, or can I comment, Mayor?
Just one moment. Let me just ask if the motion has a second, then we'll come right to you, Councilmember.
I will second the motion, but I'll have some potential modifications or amendments.
Okay. So Councilmember Rennis and Vice Mayor will speak. Go ahead.
Did that motion get seconded?
Yeah, there was a second, but
Are coming to work because they either want to put food on the table for their families, or because they're, in that situation where they're being forced to just be there. because they have no other options. So this is really what this is about. And if so, you know, I read a tweet from former Secretary of Labor, Chris Liu, who said, you know, for those companies that have workers that don't have any sick pay, why don't you put a notice in front of your establishment saying, we don't offer any sick pay to these workers, so, you know, come in at you know, your own exposure. Obviously, he was trying to make a point. And the point is that when we have these essential services businesses open, that we want to be able to go in knowing that these workers are offered sick pay and that they are not there because they have no other option. And so this is what it really is all about. It is not trying to hurt any of the small businesses. It's really trying to protect all of us, because we know containment is the best for right now, the best solution. And so I'd like to be able to make maybe a friendly amendment and see if we could, Councilmember Camus, maybe we could take this to the full council and have a discussion. It sounds like there's plenty for us to discuss as a council, as administration is doing their own research, that we could also place this on a council agenda and have a discussion.
Well, obviously, this Rules Committee is here to flush out things before it gets on the agenda, and if it gets on the agenda as it looks, we may be putting a lot of sausage making in front of the council. So I'm not inclined to do that. The memo also doesn't say for essential services, it just says for any business. There's no specificity. This would apply to any specific sector. And so it's a very...
Well, this is exactly why we need to bring it to the Greater Council, take it to the Greater Council, and everybody together can help define this, instead of leaving it just to the five of us to decide how staff should move forward with this.
Yeah, I'm not inclined to go that direction. I prefer to have something a little more fleshed out before it goes to council. I've been in so many meetings where we didn't have, a solid thing to work on, and it would take 6-7 hours, and we still don't end up with something. I'd prefer to flesh this out further before we take it to council.
Vice Mayor?
Thank you, Mayor. I think we all have the same objective, and that is to get money into the pockets of the employees who are laid off or have their hours reduced or have to stay home because they're sick. So I think everybody has that same objective. The real issue in question is, where does that money come from? And there's so many moving parts right now with the federal government, the state government, the county, that I need at least a week and have staff come back with an analysis in terms of all the moving parts, what's out there, what's been voted on, what's been approved, the segmentation of the different business types that we're talking about. There's just so many unknowns that I don't have that information right now, that I need a week and have staff come back and provide me with a lot of that information and data. So that was one of the friendly amendments I'd like to make. Councilmember Camus, is instead of 2 weeks out, a week out, if we can have that, and have staff, if staff is able to come back with some type of analysis with all the bills.
Yes, yeah. And if I could, I want to just kind of summarize where we're at. So yesterday with the council, we shared our top 10 priorities. Number 2 is enforcement of the public health order. Our focus on this, obviously the council can direct us to broaden that, but our focus on this would be to ensure that essential workers are not compelled to come to work sick. That's where we need to focus. And if they don't have any leave and they're compelled to do that, that is exacerbating the public health crisis. So that's where we would initially like to focus, if we could, because I think that is the most critical, important piece of this.
Okay.
I'd certainly support that to see if we could, and I assume that would take the form of an urgency ordinance so it could be enacted quickly if, okay. So I think that was a request for a friendly amendment of Councilmember Kimmis.
Yeah, so, but this memo doesn't spell that out, so it would have to be put into my motion. Is that what you're saying, City Manager?
Well, I think that would be helpful, but, I think when we come back next week, you're hearing a preview of what I think we're going to say. But as I said, obviously, the council can direct us to broaden that scope to address the economic impacts. But just, based on where we're at right now, it would be best if we could focus first on the public health impacts.
That's fine. I'm willing to hear about the public health impacts, especially for essential services specifically, and I'll put that into my motion.
Okay. And I just want to ask Council Members Reynes and as far as just kind of a fundamental question. Do you care as much whether that pay, that sick leave pay, comes from, say, a small business that's in distress, or from a government entity like the federal government or state? Are you concerned whether the source of those funds, as opposed to the fact that those individuals get the financial resources they need to sustain their lives and livelihood?
Well, I think our fundamental concern is public health and making
Right.
sure people don't die, right?
Right.
So what I will say is that we can expect federal stimulus packages to go to businesses that can document these issues so that they can get that. My concern is the workers from those businesses aren't going to have sort of the basic sick leave coverage to cover them during, at minimum, the life of this order, which could be extended if people don't stay home, right? So, I mean, we're all looking towards the federal government to provide that stimulus package, but we wrote this before the order, before Monday's order, when we thought everybody was going to be going to work, and the county was coming out with kind of daily updates on what we should and shouldn't do. And so, I think our focus should be on taking care of our community and then pushing the federal government to backfill, which is the direction that we gave that kind of flexibility to staff last night when talking about rents and small business.
Okay. Councilmember Arenas, did you have a comment, or are we good?
Yeah, thank you. Of course, I'm concerned of our small businesses, and that's why I supported what we did last night on the moratorium and the next steps that we've set up so that we can have some emergency funding for our small businesses. Those are the families, those are the small businesses. I've said before, and I continue to think the same way. They're the backbone of San Jose. They're the ones who have made us so far, and so they deserve our support and loyalty. We also need to make sure that our public is just as safe, and that when we walk into that whatever essential service business that we go to get our essentials, that we are guaranteed that none of the folks who are there because they're forced to be there because they're sick, but that they have this option for sick leave. And I think, if I'm not incorrect, I think it was Mr. Buchanan who mentioned there was already some stimulus money that would allow for some of the small business to apply for and have some of that liquidity to cover some of these costs for their employees. So I think there's already some forethought there for small businesses. It really is something that I think is essential to public health. It's not a union thing. It's not a nonprofit thing. These are all employers as well. It really is about making sure that when you walk into an essential service company, that you have this assurance that nobody who's on that floor or inside that company grounds is sick. It really, that's what it comes down to, but I think people are viewing this as something quite different. And my intent is not to put small businesses at risk, rather than my focus is to make sure that our general public is not at risk of this virus.
Okay, well, I appreciate that, and again, I see so many areas where we totally agree. One is that employees should not have to go to work if they're sick. It's a public health and public safety issue if they do. We both agree, we all agree that these employees should get some type of compensation if they're off for sick leave. It's just a question of how that's executed in the mechanics and the logistics of that. So I think that's where I'm struggling in terms of how to get money into the pockets of those employees without damaging or putting small businesses particularly out of business. Because as we know, if they're out of business, those employees don't have a job at all. So how do we reconcile that? So that's where I needed additional time to work through that, hopefully, getting an analysis and feedback from staff as well. So that's why I'm supporting the motion with a 1-week timeline.
Okay, and that's okay with the make of the motion?
Yeah, yes, and then again, specifically for the businesses that are necessary to be open, and not necessarily what the memo states, which is any business.
Okay, any other comments from anyone?
Mayor, if I could just make my last comment. I know that if I make a substitute motion to move this to council, it will fail because I haven't heard anything from anybody that will make me think that I'll have a second in the room, which is a shame because I think this is something that our colleagues should also be included in this conversation. And I think what has transpired so far is picking and choosing aspects of this memo without the real intent of keeping all of us safe when we think about essential services. So I am going to support the motion on the floor, but not because I believe in it, but because I think it's, at the very least, I need to move forward and make sure that we're diligent about providing a safe space for all of us when we go to any essential service. I happen to be at a doctor's office. I want to make sure that when I come into this building, that the people who are working here have paid sick time off and that nobody's there because they're forced to be there to put money on the table, to put food on the table, to keep a roof over their heads. And this is what it really is all about. And I think our federal government is also responding to our small businesses by having some of these money flowing and some liquidity to small businesses, but it doesn't seem to matter to this group at this point. And it really is a shame. I'm disappointed in the conversation, that I'll move forward with it.
I had a comment.
Councilor Esparza?
Just, again, I'm also disappointed with waiting with more time because I don't feel that waiting, and although I appreciate the compromise with the vice mayor, but I don't feel waiting is helpful. I think if the CDC were here in this room, they would say, let's move on this as quickly as possible. I spent part of my day going and visiting essential businesses in District 7 who are practicing social distancing, doing takeout food. There are a lot of construction and trucking companies, checking in on them. But a lot of those employees don't have sick leave, right? Food workers, healthcare, a third of healthcare workers don't have sick leave. My mother, who thankfully is staying at home, has a caregiver, right? And most caregivers don't have sick leave. And so I just, thank you for the compromise. I just am disappointed and would urge everyone to move as quickly as possible because I think that hourly workers that still have a job are grateful for having a job and are already stressed and are going to go to work sick. Thank you.
All right, so we'll be back here next week. Dave?
Yeah, if I could, I just want to reassure everyone, we can still loop back here next week and whatever's decided, bring something forward to council on April 7th as described in the memo.
Yeah, okay.
I just want to make sure that everybody understands. We will work on whatever ordinance that we're directed. However, the details of the ordinance are going to be important. There are 8 cities that have it, so it is possible to do it. Most of the, I believe all of the 8 cities have it apply throughout the term of employment. We need to know if, in fact, what this council is asking us to do, is it just for the term of this emergency, or is it something that will continue after the emergency, so we know how to draft it? Also, there are a lot of different elements of the ordinance that need to be specified, and hopefully if we can get that next week, we can then start moving forward to try to draft an ordinance that we can bring before you so that you can, and yes, we would do an urgency ordinance as well as a second ordinance, just like we did the eviction, so that it would take effect immediately upon council adopting it.
Okay. All right, warning is heeded. He said, anything further? All right. On the motion, let's vote.
Well, can I ask a clarifying question?
Sure.
Ed, were you asking us for clarity right now?
No. I'm saying next week when we bring you the information that you're asking in order to determine how much, if you want to go forward with it and how you want to go forward with it, those are the kind of directions our office will need so that we can properly draft the ordinance with the details that we need in order to bring it forward.
Understood. And can you give us a sense of workload for the 2 options?
The 2 options.
Right, so you had said, if we're talking about just for this emergency, like we did for the eviction moratorium, versus something that will last past this emergency, what the difference in workload is?
There would simply be a difference in the term. The ordinance would probably be the same, but that's
Okay.
something for the council to decide.
Okay.
Do we need all of these provisions just for the short term, or is it something that we want in both cases? It's just a question of getting specific direction so we know, do we put provisions that it's only for emergency purposes, or is it from now on? I suspect the economic impact, while great during the emergency, may not be as great as if we do it on a continuing basis after the emergency.
Okay, thank you.
Yeah, and I just thinking about a lot of questions that have come up, and I know we'll discuss this in greater detail next week. We may want to think about, with regard to Councilmember Davis's question about those private sector businesses that don't differentiate between sick leave and time off, called FTO. I've been employed by one of those before as well, that where you've got maybe some minimum threshold of FTO that would then could be converted, so it wouldn't be creating a whole new obligation that didn't exist, where there's clearly a genuine effort of the employer to provide a generous leave policy. So anyway, I think we can work through those details, but these are all things I know we have to think through as we put this out. Because we know that as we've been dealing with the county ordinance or the emergency order, it came down, it seems like a century ago, it was just a day and a half ago. We're all spending an enormous amount of time trying to clarify what is not a very clearly written emergency order, and that's an enormous distraction for an organization that has to be focused on delivering critical services right now. And so I think we do need to take the time to make sure we understand what we're doing. Okay, anything further? All right, on the motion, let's vote.
Kemmis?
Aye.
Davis?
Aye.
Arenas?
Councilman Arenas?
Yes, I'm so sorry, I was on mute. Aye.
Jones?
Aye.
Liccardo?
Aye. All right, we'll be back next week. I think we have public comment at this time. I don't have any cards, Henry says, so the meeting is adjourned. Thank you, everyone. Stay healthy.